Okay, Assalamualaikum kepada semua partisipan ya. Kena tunggu lagi, ada lagi partisipan yang nak masuk, and probably sementara waktu tu pada yang mana hadir boleh isi registration. Sister Roshada akan masukkan dekat bahagian chat tu, probably she will share untuk registration ya. Sorry, untuk kedatangan, untuk ambil kedatangan. And then probably insyaAllah we can start after that. We don't have to wait that long. And actually sesi ni kira we will actually listen to Puan Haini dulu, and then if you have any question boleh tanya ya, jangan segan. And it is really great to have all of you here, and I hope this session will benefit ya semua yang hadir, insyaAllah.
Terima kasih.
Okay, yang baru tulis ya. So we give another 5 minutes more and then we'll start insyaAllah. Puan Haini, maybe sementara tu mungkin Puan Haini boleh kenalkan diri. Oh, nampak Liana dah. Okay, Puan. Okay, dengar. Puan Haini. Ya, you're clear.
Okay. Assalamualaikum.
Assalamualaikum.
Just
I think
okay, I've been in nursing for 24 years old. For 24 years by this year.
Alhamdulillah.
So we only register graduate and start 17 March.
MashaAllah.
For 8 years, then moving to UiTM under Ministry of Higher Education for another 14 years more lah. So tadi finish my degree in UM 2002. Masa tu dekat Hospital Kajang lagi lah. 2002, 2004, then 2005 I got interview in UiTM. Terus accepted lah to be a young lecturer ya. Masa tu young lecturer, ada skim young lecturer ni UiTM.
Alhamdulillah.
So 2005 apa tu dindong-dindong kena minta pelepasan jawatan dengan izin. Masa tu ada lah pelepasan jawatan dengan izin, tukar kementerian. So kena tunggu. Then 1st of January 2006 pergi lapor diri ke UiTM lah. Masa tu UiTM kita Fakulty of Health Sciences dekat Jalan Osman. Jalan Osman. So then kita moving nursing, School of Nursing dekat Jalan Kelang Lama. Jalan Kelang Lama, then I have to go for my masters in 2008. 2009 balik semua dah pindah ke Puncak Alam. So buka-buka Puncak Alam tu terus ke Puncak Alam lah. So dah fakulti besar kat sini, insyaAllah tak pindah lah. Cuma sekarang diploma and diploma kita ada dekat branches di beberapa tahun. So Puncak Alam will be the main campus for nursing. So all our student, bachelor, student, masters, PhD, semua dekat Puncak Alam, as well as our PJJ degree student pun dekat Puncak Alam. Of course now is online lah. All is start online, totally online, ODL, open distance learning since our PKP lah, COVID last year. Sampai this year pun still continue this semester pun still continue online class lagi. But macam kita tahulah nak pergi praktikal pun jadi masalah sekarang.
Yelah, betul.
All the school pun ada problem. Tapi kita macam sekarang dapatkan untuk yang final year student pergi ke kita punya hospital teaching hospital UiTM coming soon.
Masya Allah.
Alhamdulillah dah siap.
Dah siap
Alhamdulillah dah siap, cantik sangat nanti bila boleh datang melawat UiTM Puncak Alam tengok hospital.
Nurses yang kerja sana semua daripada keluaran UiTM ke?
Not really, sebab kita interview kita perlukan ramai, kita punya keluaran tak ramai pun sebenarnya, tak boleh nak fulfill. Tak boleh nak fulfill. So memang berapa kali dah buka interview ni, banyak kali dah ni.
Masya Allah.
So Warren memang masih banyak kosong. Kita kena buka berapa bed, kena ada berapa nurses kan. So still ongoing lah, ongoing hunting. Sebab rasanya masa kita open tu, kita serentak. UiTM.
Dah lawak-lawak ni tak. Kita macam.
Ada yang tak.
Ramai orang nak cakap.
Ada yang tak mute. Ada yang tak mute. So masa kita buka teaching hospital, serentak teaching hospital, UM buka, Unisa buka, UIA pun buka. So all memang nak gather the nurses lah. So kita ni nurses ni all around lah. Memang perlu nak nurses ramai-ramai. So kena itulah. Tapi UiTM memang tak ramai sebab kita once a year. Intake kita once a year.
Oh, ada. Macam-macam.
Ada laptop.
Itulah.
Okay, so agak sukar lah kata nak fulfill dengan 4 hospital serentak buka satu Malaysia kan. Kalau UiTM pun kita punya student banyak yang private.
0.5.
Dia orang tak perasan ni, dia orang tak.
Itulah saya rasa dia tak perasan.
Ni tak PPUM.
Excuse me, semua partisipan tolong mute mic boleh tak? Just in case kalau ada soalan nak tanya, you can just type and then baru kita release mic lah so that kita tahu you ada soalan kan. You can raise your hand, kan ada dekat
screen. Pioneer lah UiTM Puncak Alam buka 2009 dan terus balik ke Puncak Alam. Sebab pindah pula lah daripada Kajang ke Puncak Alam. Dah jadi orang Puncak Alam lah selama berapa tahun dah, 18 tahun dah kat sini kan. So memang stay sini lah. Dan kena pula pergi semula menyambung pengajian PhD. 2013 kena pergi lagi. Tu alhamdulillah rezeki lah dapat scholarship kena pergi. Requirement for lecturers kena ada PhD. So terpaksa lah, paksa rela pun kena pergi dah lah. Tunggu. InsyaAllah lah. Coming soon lah, tak tahulah.
Okay, Puan Haini, boleh mulalah. Saya semua dah ni dah. Agnes saya beritahu dah boleh ready dah. Okay. So macam mana sesi ni? Do we ask question in between or can we keep the question at the end baru tanya? How do you want it to be?
Keep it to the end lah.
Okay.
At the end.
Okay. Barang soalan ni tolong simpan, lepas tu nanti at the end of it kita boleh tanya. Thank you very much. Give the mic to Puan Haini Dipersilakan.
Okay, thank you. Sekejap saya share my screen. Okay. Nampak tak? Saya dah share, nampak tak PowerPoint?
Nampak. It's clear. Alhamdulillah.
Okay, Assalamualaikum and good afternoon all. Nak cakap bahasa Melayu ke? Nak campur-campur ni?
Campur-campur boleh Puan Aini. Boleh.
Okay, I will start the session. Okay, thank you, Mr. Sharin, for inviting me to be a speaker for today. Just a sharing session, I think. I would like to share a part of this is a part of my PhD study actually, and part of the research. This paper has been published in the journal and have been presented to one international conference, and it also was awarded as a best presenter paper lah.
Masya Allah.
Alhamdulillah lah, saya pun did not expect to get that best presenter award pun sebab tak sangka pun sebab ramai kan.
Alhamdulillah.
So I think because yang partisipan conference tu dia bukan background kita tau, medical ke, dia banyak background. So maybe they are very interested to know about our discipline lah. So the study is about the practice of patient education among nurses, among our nurses lah in among the public hospital nurses in Malaysia. So before I further, can we just see this video?
Mama baca buku tak hari ni? Kerja sekolah ada? Ada tak? Ustazah bagi kerja sekolah. Mama? Ada Ustazah bagi kerja sekolah?
Okay, this is the background of the study. As we all know, I think most of us nurses, is it? The participants are nurses, I think. So patient education is important to increase an individual awareness regarding health to achieve better health and improve quality of life for effective long-term results. Nurse as an educator always be an example and being a guide to community. Therefore, the nurse need to prepare themselves with various skills to provide adequate health education to patients. What is the problem with this that I come up to this study? Because our number of re-hospitalization patients keep increasing due to lack of health education during the discharge process. And effort to improve the practice of nurses as an educator to patient needs to be implemented as soon as possible to overcome this problem. Okay, by doing the exploration of the current patient education practice will help to overcome the issue of hospital readmission and patient able to manage their activity of daily living after receiving effective patient education. This study is to explore the perception and practice of patient education among nurses in one of the public hospitals in Malaysia. So our objective for this study is to determine the perception regarding patient education among nurses in one of the public hospitals in Klang Valley, and to identify the factors influence the practice of patient education among the nurses. Okay, this is a cross-sectional study. We use the survey, just a hard copy public hospital in Klang Valley, and our total sample is 246 staff nurses who were involved in this study from various disciplines. And the questionnaire is adopted from TOMA 1999. This questionnaire was divided into 3 parts. Part A is demographic characteristic of respondents, such as age, gender, ethnic, marital status, and educational qualification, and history of hospital admissions of patient education. And we use descriptive statistic for categorical data to describe the participant perception towards patient education, such as frequency and percentage and mean. Okay, this is the result, some of the result of demographic data, which is the majority of the participant or the respondent within 25 to 34 years old. Mean is very young, very young. 69.9% is very young nurses. And of course, we know that we are dominant by female. Nurses is dominant by female, so of course the highest percentage, 92.3%, is female. Then come to their experience, they have less than 5 years experience. 62.6% have less than 5 years experience working in as a nurse. And their education, of course, majority of them, 95.5%, have diploma as their background of nurses education. It's very good sebenarnya. Okay, this is some of the question that to answer objective number 1. Okay, some of the question from down there, there is an adequate number of nurses to do patient education. There is adequate time to do patient education. There are adequate patient education material available for nurses to utilize when doing patient education. And 3 of the top, number 1, number 2, number 3, with the highest mean is the nurses perceive that other disciplines need to be more involved in patient education, 4.23. And the nurses should assume the responsibility for coordinated patient education, and lack of time is a factor why documentation of patient education is not done. And we will discuss about this later. So on the perspective of the factors influence the patient education, when we ask the nurses, some of the variable here, lack of time, inadequate staffing, lack of knowledge, which I have been highlight, is the highest frequency and percentage, 70.8%. The nurses say that factors, the factors of lack of time to make them not to give patient education, not they don't want to give, but because of the time. And inadequate staffing, I know everywhere in the world also we have inadequate staffing for nurses. Then lack of knowledge also come to the 1 to 3, the highest factors. And the other factors is inability of resource material, low priority to nursing tasks, environment, not my responsibility, patient education not enjoyable, patient not receptive to teaching. There is some of the questions that have been asked. So if you see the call you nurses, total call you nurses, your superior call nurses, your subordinate also call you nurses here and there. So everything is nurses doing. Yeah, that's why I think we don't have enough time to do patient education. So what are the nurses' perception regarding patient education practice? Most of the nurses perceive patient education as high priority in nursing care, and it has responsibility to provide patient education. That means the nurses know that patient education is very important, very important. They know, but not they don't know. They know that, and they know that it's a part of their responsibility to provide patient education to the patient. And based on this study, most of the nurses agreed that other healthcare providers also need to be more involved in patient education and give a cooperation to increase patient knowledge. Okay. So in the term of factors influencing the practice, lack of time, inadequate staffing, lack of knowledge were the factors contribute to the practice of patient education among the nurses in this public hospital. Kwan and Juni 2017 revealed that the nurses think that health education is the least significant of their responsibility due to busy nursing tasks. So because of the nurse do other tasks, they have lack, then they sometimes they miss out to give the patient education. And result from this study identified that nurses' working experience and level of education determine the priority staff nurses place on patient education practice. So it means when you go out for you have your knowledge, you improve your knowledge, then you can disseminate the knowledge to your patient. Okay. Of course, the nurse have to have the knowledge, because now the patient, your patient is more knowledgeable than you. For example, is diabetic patient. Of course, they have fingertips, all the information. They have access to Google everything. They can ask everywhere. They just do the thing, all the phone, all the smartphone. They can have all the information there. That's why we have to enhance ourselves, like update of diabetic care, segment. So when patient asks us, so we know how to answer it. Or we are the one who give the patient education about diabetic care, for example, diabetic food care. I think I remember last time when I do my degree, I do one project on diabetic food care. It's a very sadly to know patient have diabetic for 6 years already. When I asked the patient, have anyone told you about the food care? He said nobody. Yeah, very sad tau kalau dengar macam patient dah lama kan diabetik, tapi bila tanya pun tak ada orang bagi tahu pasal penjagaan kaki, tak tahu. Kesiannya macam kita tak fulfill kan our duty as a nurse macam tu. But I also being a nurse in the ward kan tahulah kena kesian ke patient. Baru jumpa beberapa patient kan kesian. So then Afani et al. 2013 also found that lack of time as the main barrier to do patient education, because nurses have their own tasks besides doing the patient education. However, age, gender, working area, and total time they spend in patient education did not determine the staff nurses' priority for patient education practice. Okay, for the recommendation after we do the study, event of the patient education conducted in various public hospitals in Malaysia, but I mean, we have to do maybe a live study. Not that we just plan, we're not planning our patient education in the first place. We have to explore what they need, what the patient need, what we can improve from that. So after the exploring study, baru kita boleh plan maybe structured education when we have to give it, macam patient discharge mesti dapat apa-apa lah, for example. So in order to enhance patient education, more strategies required to address the inadequate staffing, lack of time, and lack of knowledge. Macam kita kata inadequate staffing, kita towards to the up, the administration level tu sangat susah lah kita, sebab everywhere pun ada masalah inadequate staffing. In terms of lack of time, I think we have to manage our time. I think masa time Syahrin as a staff nurse pun, saya as a staff nurse pun, kita pun sibuk juga, tapi dia sambil tu cakap dengan patient. Macam saya tengah buat dressing pun, sambil tu teach patient. Sambil-sambil tu, tak adalah kata perlu ada satu session, ambil patient, bawa kat mana-mana untuk buat patient education. No need macam tu sebenarnya. Kalau sambil-sambil buat backmaking, sambil tu pun boleh teach patient kan. Sebab masa kita kata semua orang ada masa yang sama sebenarnya. Dan patient kita dulu ramai, sekarang pun ramai juga kan. Sama juga. Dulu kita manage 2 staff nurse, patient 60 orang boleh manage juga. So how we manage sebenarnya, how we work lah, macam saya tak tahu lah, sebab mungkin jiwa saya ni memang suka cakap kot, sebab tu kena jadi lecturer pada. So suka teach. I like to teach my patient. Not my patient, I like to teach any students. Mana-mana student datang pun saya akan sambil saya buat kerja tu sambil saya ajar. Sama juga sambil tu kita ajar patient. Tak kisahlah tengah buat operation. My background is orthopaedic. So orthopaedic ward for 8 years. So memang sambil betulkan traction, sambil tu bercakap dengan patient. Sambil betul-betul betulkan kedudukan kaki dia. Betul. Sambil tu pun advice patient. Tu adalah kita punya patient education sebenarnya. Okay. In terms of lack of knowledge, kita lah kena enhance. Sebabnya macam saya kata tadi, our patient is very educated, very knowledgeable. Kena kalau macam saya punya PPU UiTM, our teaching hospital dan our pusat perubatan pakar UiTM, of course yang datang tu adalah profesor, pensyarah UiTM. Even though dua sendiri pun macam akan bagi suggestion untuk study. Diorang jadi pandai lah saya rasa. Juga patient kita yang dekat luar sana, diorang memang dah pandai. Kalau kata dia sendiri, sebab dia explore all about one thing. Contoh dia diabetik, dia akan explore semua pasal diabetik dia tahu. Kita sebab banyak benda nak ingat. So kita pun sendiri kena upgrade our knowledge. And not necessary to go for a big course. Not necessary nak kena pergi buat degree baru nak upgrade knowledge. No. Every day boleh update knowledge. Read the journal, read the newest finding, evidence based of clinical, semua boleh sebenarnya. Report, benda-benda macam tu kenalah. Hari-hari balik kena study juga. Okay. Then this study was funded by UiTM Grant Project lah. Okay. So this is some of the reference, maybe siapa yang berminat untuk buat tentang patient education, there's a section you can get lah. Saya akan bagi juga nanti share. Then everybody also can read my full paper. Full paper tu dah ada dekat EVP Journal, Proceeding Journal ni, memang dah publish. So memang boleh Google dia tajuk tu, you akan jumpa. Memang
dekat dalam Mona punya website ada kan?
Dalam Facebook Mona pun saya dah letak dia punya link. So boleh, everyone can access. You can freely access and read the full paper. Okay, I think that's all for my sharing today. I dekat hospital. Okay, that's all for today. Thank you for listening.
Okay, thank you Puan Haini. So, does anyone have any question? Ada soalan nak tanya Puan Haini, can raise your hand or you can even type. Kalau nak cakap pun boleh. Santai-santai lah ya. Please do not be shy, jangan segan.
Tanya je, nak tanya apa.
Ini sesi untuk kita belajar. Ada soalan?
Atau ada anybody nak buat research tentang tajuk ni pun boleh nak tanya. Metal Syarin pun ada ni. Saya hantar student kat dia untuk kalau datang.
At the end of it, Puan Haini, tadi Puan Haini kata if we want to look to actually explore in the sense of nak explore patient punya experience pula, do you think it is better to do it as qualitative?
In
qualitative.
For the patient memang kita kena buat interview.
Kalau kita interview, probably kita boleh faham in depth kan apa sebenarnya.
So part of my study also memang saya buat dua. Satu, we survey to the nurses, and another thing memang kita interview the patient.
Mixed method lah basically.
Mixed method basically. Memang kita interview, macam my background is orthopaedic, so memang saya interview patient orthopaedic lah.
Okay.
Tanya dia orang.
Untuk interview tu berapa partisipan?
When we got saturated data itu, sebab kita buat genetic, so saya punya qualitative is about small lah. So bila dah dapat patient, agak sukar sebenarnya.
Betul.
Tahulah kalau patient kat klinik dia nak tunggu nombor dia. Lepas tu dia nak kena pergi x-ray. Lepas tu kalau patient in pain tak boleh nak soal. So kita nak cari yang voluntary kan. So I dapat masa tu dapat 11 ke 8. Bila 8 tu dah saturated. So bila kita tanya soalan tu jawapan dia lebih kurang sama. So we stop there lah. Tak dapat ramai lah.
So a part of it, kalau tengok daripada kebanyakan jurawat yang Puan Haini bagi your study paper basically is very young kan, among antara 25 hingga 34. Kita boleh dapat dekat situ kebanyakan jururawat kita even mula bekerja pun ramai, bukannya semua dalam kategori 18 tahun. Sebab saya bahagian service side kan, kadang-kadang bila kita tengok jururawat yang lapor diri kat kita, kadang-kadang dah menunggu 1-2 tahun dah baru dia boleh dapat kerja. So basically kalau dia masuk pun dalam lingkungan macam itulah 25 ke 30 ke atas kan.
Me myself about late. I working at 25 years old.
Wah,
25 baru saya, sebab saya student, saya dah 21 dah masa tu. Orang lain macam habis SPM dapat kan. Saya macam berapa kali minta interview macam simpanan dan baru
dapat rezeki.
Baru rezeki. So kerja tu memang umur 25 dah. 25.
Tapi itulah, kita tak boleh nak nafikan lah masalah tentang lack of basically lack of staffing.
Betul.
Lack of staffing lead to that our nurses unable to do, bukan unable to do satu hal, patient education, sometimes unable to do a very comprehensive patient education.
Nah, very comprehensive tu memang susah nak dapat lah.
Sebab kalau kita tengok dekat abroad, satu nurse jaga 4 patient. And nurses dekat sana boleh duduk sebelah patient dan bercerita lagi.
Betul.
They can really converse between each other. But our nurses kalau duduk kat sebelah patient tu nampak pelik pula kan. That's the thing that and then probably our culture kan, bila orang tengok nurse tu duduk je dah jadi satu masalah.
Itu masalah satulah culture kita lah.
Sebenarnya kadang-kadang nurse duduk sebelah patient probably
bagi tahu
good because they are discussing and talking to the patient. So but itulah the thing is kebanyakan patient kita pun tak berani nak tanya it from us kan.
Betul.
Dia segan nak tanya, takut salah tanya, macam-macam.
Itu another one culture tu. From my study memang I observe tu. So my supervisor pun cakap nanti kena discuss lebih pasal culture. Sebab kalau kata masalah tu kita tanya satu soalan, dia akan jawab banyak tau. Betul sama. Memang culture kita macam very macam menjaga cakap pun tak banyak macam ada apa-apa nak baiki ke? Tak ada komen.
Semuanya okey.
Semuanya okey. Padahal kita tahu lah kan. Tapi
itulah masalah dia.
Mungkin culture kita tak pandai untuk very elaborate atau explain.
Betul.
So macam simpan perlu dibaiki kan.
It's a very interesting subject that you have undertaken untuk study ni, sebab kadang-kadang kita anggap tajuk tu nampak simple sangat kan.
Tapi the behind that sebenarnya is very important tau sebenarnya. Sebab saya memang melihat kepada patient education tu sangat penting sebenarnya. Macam contoh saya bagi tadi lah, kesian kat patient. Itu baru berapa patient kita jumpa, kesian kat patient dan 6 tahun ada diabetes tapi tak tahu langsung. Tak pernah pun ada orang cerita dengan dia. Very sad lah macam kita sebagai nurse.
Contoh saya nak share pengalaman sepupu saya lah. Last year he had a very bad accident, pokok tumbang jatuh atas dia. And dia dapat fracture cervical, internal fracture ribs, kidney injury and everything. And then when he landed dekat hospital kan, tak payah cerita hospital mana kan, but the thing is what I can see is that because dalam family saya ada 3 orang nurses, ramai kan, doktor pun ada, tapi when it comes to bila kita explain kan pada mak bapak dia kan, okay, kita faham nurses sibuk, so kita cakap okay, make sure pusing dia setiap kali 2 jam, sebab apa tak boleh nanti takut jadi ni, jadi luka. Make sure ingatkan nurse buat suction pasal ada trachea semua. But with that education that we gave to our uncle and wife dia, alhamdulillah he had a very bad injury and now he's walking and even trachea dah lepas. Tapi bila saya tengok macam tu, even the doctors was so amazed. tak ada bed sore. Pada apa yang saya nak sampai kat sini is that kalau kita sebagai jururawat dapat bagi tahu benda ni pada family dan betapa pentingnya benda tu, kita sendiri boleh guna family member.
Dia kata kita have educate also the public people, even though the simple thing.
Betul.
Simple thing pun penting sebenarnya bagi tahu. Kadang-kadang orang tak tahu kecilness ni apa. Sebab masa saya present tu, the professor yang judges tu dia memang tanya. Dia kata, adakah memang nurse yang bagi patient education? Tengok, dia orang pun tak tahu. Dan saya kata memang sebenarnya nurse yang kena bagi patient education. So dia orang tak nampak benda. Saya kata, patient aid apa semua, saya kata tak perlu pun bawa patient tu ke mana-mana. Masa patient tengah kita buat prosedur tu, we can explain. Kata, saya siap bagi contoh lah.
And then bukannya patient education tu kena bagi semua satu hari.
Ya, betul.
Kita boleh pecah sikit kan.
Ikut kemampuan pesakit, dan kalau ada relatif, kita ajar relatif juga.
Betul. Itulah, that's the most big thing. Kita anggap benda ni simple, tapi sebenarnya the impact that it will give to the patient and also the patient punya relative is huge. And indirectly dia membantu kita juga. Tapi ada satu, saya tengok soalan dekat situ, Puan Haini ada tulis ya. Adakah kerja seorang jururawat itu untuk bagi patient education? Adakah daripada disiplin lain pun memainkan peranan? I think I've seen that question. Did you just put it up? I think is it nurses task apa kan? Saya lupa tadi, saya ada tulis satu. Ada disiplin more involved. So what does it mean actually kat situ? Ada disiplin should be involved.
Contoh for example, kalau kita in orthopaedic, kalau kata physio datang ke ward bagi tahu tentang penggunaan tongkat. It's not necessary sebenarnya tunggu physio tu datang bagi tahu pasal tongkat. Nurse sendiri pun kita boleh bagi tahu dekat patient kan. Macam kata kita tak sempat maybe. So the physio datang, physio pun akan bagi the information to the patient kan.
Betul.
Contoh about exercise. Mungkin kita tak boleh nak really teach the patient quadriceps exercise yang proper. Kita boleh teach ajar, tunjuk kan, tapi yang betul-betul proper tunjuk how to do it, yang tu the physio. Tapi kalau my experience dulu dekat hospital Kajang, physio satu hospital ada satu je.
Betul.
So nurse juga kena remind patient kan, every time kena buat exercise, kena tunjuk dengan dia. Tak boleh, memang tak boleh tunggu physio. Kalau physio macam tu.
So, does anyone have any question? Sesiapa saja. Liana, tak ada soalan ke?
Tuan segan nak tanya soalan ni.
Jangan segan lah.
Jangan segan. Siapa nanti orang nak datang, siapa datang tadi buat EPJJ, memang kena buat research nanti. Ya. Cantik nak tanya. Cantik.
Use the mic, Shanti.
Congratulations, really proud of you that for your achievement.
Thank you.
First of all, I just would like to ask, this is actually a usual or common issue that always we highlighted, right? So thank you for highlighting this topic. You are very, very right that we need to emphasize or encourage nurses to give more health education. Just a little, I just need your input. I mean, your opinion. How about, I have read some of the article. They said that some of our nurses, our culture, we worried about language, because most of the journals are all in English, you see. It's not a friendly user for our people, I mean, our culture. So how can you, give your opinion that you can encourage or motivate all the nurses out there to learn or study on an evidence-based practice?
I think in hospital level, we have like, the doctor have CME, we can use our CME to sharing about all the study have been done actually. Sebab kalau ikut journal, memang kalau kata nak tunggu nurses baca journal, nurses especially yang working lah, kalau yang study tu memang dia terpaksa baca kan. So kalau yang working, they don't have time atau they won't look to the journal, especially in English journal. Sebab kadang-kadang saya kata people out there, we can't wish that because of the language satu, because kita punya publication journal sometimes tak accessible. So how we have to disseminate the finding. Macam ni contoh disseminate the finding. Salah satu platform sekarang kita buat webinar lah kalau tak boleh buat seminar. So saya rasa perlu ada macam schedule siap ni to siapa-siapa lah mungkin among the staff also memang dah pernah buat dia punya research. Tapi kadang-kadang research tu just untuk hantar ke universiti dan simpan dekat college tu. Sayang tau sebenarnya. Tu patutnya kita kena bagi tahu benda tu dekat orang, maknanya nurses sendiri, to motivate them, to educate them. Maybe we can use the sekarang also baca social media. Orang suka guna social media, so we can put in the Facebook. We can use just a layman word, bahasa biasa dekat Facebook, share. Saya pernah tulis masa saya buat operation hari tu, last 2019, bulan 9. So daripada saya share contoh saya buat operation apa, saya cerita kat Facebook. Dan treatment yang saya dapat, saya cerita kat Facebook. So saya cerita pasal tongkat, saya cakap dalam bahasa biasa. Saya rasa banyak feedback lah juga yang orang baca-baca tu kan. Kadang-kadang orang faham. So saya rasa kita kena buat lebih lah benda tu. Sebab memang kalau nurses memang kita kena buat webinar banyak lah sekarang tu. Kadang-kadang mencari information atau ilmu yang boleh di-share. So peringkat hospital kalau kata CNE mungkin kita boleh encourage. Kadang-kadang ada nurses yang dah graduate kan, dia dah balik daripada dia sebab kalau kita kan mungkin buat research. Tapi sayanglah study tu dia just guna finish it then untuk purpose for the lulus passing the exam dia. Sayanglah, sampai tu tak ada disseminate the finding tu tak sampai balik dekat Metro Sharina contohnya lah. Jadi saya dah sampaikan Metro Sharina dah tahu dah tu dia punya result tu. At least we can do something from that lah.
Betul.
Lepas ni banyak lagi nak collaborate research insyaAllah.
So, thank you Shanti for the question. Ada siapa lagi nak tanya soalan pada Dr. Hani? If you have any question, you can ask. And I would like to, actually inform semua orang ya. If you will have this kind of talk at least 2 kali dalam sebulan, insyaAllah. Because buat masa ni we can't actually have a khusus secara meet up in a as a seminar or whatever. So by doing this, saya rasa, and we hope that it will benefit many orthopedic nurses. So that we learn and then we share with all of you, and probably all of you also have gone through or done any research. If you want to present, you can actually come contact us in Mona. If you want to present your research, it's okay. Any of your student, Puan Haini.
Sure.
We can actually give them. We can give them this platform so that they can berani cakap and also share the knowledge that they have dengan semua jururawat kita, supaya kita we basically learn from each other. That's the only thing. And adanya Malaysian Orthopaedic Nurses Association is that kita nak actually gabungkan semua all our talented people in one platform so that we can learn from each other. Itu nawaitu kita. Ada soalan ni, Puan, sekarang ni kebanyakan jururawat kurang berkomunikasi dengan pesakit disebabkan kekangan masa, biwal pesakit yang tinggi. Bagaimana nak mengatasi masalah ini?
Okay, tadi saya ada mention dah tu. In term of patient education ni, saya rasa tak perlukan satu another session yang khas. Sambil-sambil buat making, boleh cakap dengan pesakit. Okay, suruhnya pergi mandi, pentingnya menjaga kebersihan diri, contoh kan. Kalau patient tu smoking kan, selalu kita buat making, kita jumpa rokok bawa bantal je kan. Sambil kita ambil rokok, sambil tu pun kita lah kita kata macam kita kata apa? Kita macam torture, bukan torture the patient sebenarnya, kalau kita beliti kat patient tu, beliti tu sebenarnya adalah memberi pendidikan kat patient. We have to teach them sebenarnya kenapa pentingnya dia stop smoking. Kami tu cakap kenapa kita perlu ambil rokok dan buang. Why we need to galakkan dia stop smoking. Kita katalah kalau patient ada wound, dia ada luka, pengaliran darah akan lambat, ada luka lambat sembuh. Itu contoh lah, itu yang benda simple, itu yang memang selalu saya buat dulu kawan. Hari-hari check patient tak boleh rational, masih meneruskan tabiat lah. Kadang-kadang bila pesakit ni masuk ward, dia dengar cakap nurse sebenarnya.
Betul.
Ya, memang dia betul dengar cakap nurse. Patient suka dengar cakap nurse. Dia ikut macam sekali saya advise patient saya kat macam ni. Saya kata kalau nak cepat baik, dengar cakap misi. Betul dia orang akan dengar cakap nak bila dalam ward dah 2 bulan. Masuk ward dia tobat sekejap. Tapi sekali lepas 6 bulan nanti masuk ward lagi pula. Biasa tu jumpa macam tu. Dia dalam ward dia akan dengar dia orang akan very listening lah maknanya tu the nurses. Tapi sambil kita buat prosedur memang kena cakap dengan dia. Dulu saya punya even though saya punya specialist dulu sebelum dia jadi specialist di MO dia kan. Best tak jadi lecturer. Saya kata saya penat. Saya terpenat ambil. Dia kata bukan memang tak suka ambil. Jadi itu kalau kena ambil dengan saya juga. Punya patient kita dengan doktor pun kena juga. Yelah. Kita tu very working in team. Sangat dengan doktor memang kita betul-betul hand in hand working in team kan. Even though ada nurses kan, 2 orang nurses, patient lelaki. Memang doktor akan jalankan sama. Tapi itu sama dulu kan, best kan. So communication saya rasa mana-mana pun communication problem. Secara face to face ni masalah ni sekarang. So dia banyak bercakap kepada social media. So dia macam jadi kekangan.
Okey, ada satu soalan daripada Liana. Salam Dr. Hani. Saya just harap nurses dokumen even sedikit pun education yang diberikan kepada pesakit. Sebab dari experience some patient akan kata taklah nurses tak cakap apa-apa, POP dan lain-lain.
Ya, betul.
Documentation tu penting.
Ya, betul benda ni berlaku. Sebab kalau patient nak balik kadang-kadang macam patient tahu about penyakit dia, mungkin dia tahu sebab doktor dah cerita kan. Tapi macam kita bagi leave lah tapi kita tak cakap. Ataupun lepas tu kita tak rekod. Betul yang patient cakap tidak tu, tapi pentingnya memang kena ada documentation tadi. Sebab tu yang tadi kita kata the reason why the nurses tu kadang-kadang dia bagi tapi because of busy dia lupa nak dokumen ni. Betul. Benda tu kadang buat walaupun simple. Kena tulis hari ni kita ajar apa kat patient.
Tapi saya selalu cakap dengan nurses saya, you always to actually do good to the patient is that of course kita ajar, kita bagi patient education. Penting sangat documentation because documentation is actually adalah dia sesuatu benda yang boleh mewakili kita. Bila kita tak ada dekat situ dalam satu masa-masa tertentu tu, documentation tu lah sebenarnya mewakili diri.
Jadi evidence. Evidence. Masuk court pun perlu evidence. Kalau kita kata
3 tahun masih boleh masuk court lagi.
Betul.
Kita pun dah tak ingat patient tu dah.
Kita tak tahu benda tu akan datang, akan dicuri kemudian. Tapi better kita memang tulis, kita biasakan buat documentation, InsyaAllah tak adalah masalah.
Benda ni nampak remeh tapi bila when things get tough and then masa tu kita regret is tak, orang kata susah lah kan.
Benar, dulu pun kat Kajar adalah juga kes yang melibatkan nurses kan. Itu court masalah juga tu bukan satu hari dua boleh settle, bertahun-tahun documentation.
Farihan, ada satu soalan. Salam Puan, macam mana kita nak give education to patient and family, especially spine case yang memerlukan perhatian, extra care dan info supaya family nak take part. Saya banyak selain semua kepada nurse. Itu ini actually Puan Haini jawab lah, nanti kan saya bukan.
Saya
pula pergi ambil test.
Buat selalu ni kan. Okey, salah satu daripada caranya mungkin tadi public people, they wouldn't know sebenarnya kita punya responsibility atau tugas kita lebih daripada setakat nak tukar pampers tu ke nak buat sponging ke. It's more than that. Sebab public people memang tak tahu sebenarnya kerja kita nurse ni lebih daripada itu. Tapi kita lah yang kena bagi tahu sebenarnya. Kita yang kena bagi tahu. Clear, ada part-part yang diorang tak faham. Macam kita, mula kita ajak slowly. Okay, boleh tak sama-sama kita buat kan. Lepas tu sambil kita buat tu kita bagi tahulah kita pelan-pelan kita. Tak boleh lah macam drastically suruh dia buat tu memang takkan dapat lah. So kita slowly dan sambil tu kita selitkan juga lah kot tanggungjawab anak kepada ibu bapa yang wajib jaga ni siapa macam tu kan. Contohlah. So kita libatkan benda-benda tu juga. Memang kalau kata ada juga family yang memang totally lepas tangan kat kita lah. Lepas tangan kat patient tu seorang atau banyak benda lah kita kena settle untuk patient kan. Salah satu tu kata every time kita buat prosedur ajak. Nanti lepas tu sambil tu kita ajak pusing tu kita kata okey kenapa kita pusing ke sebelah kiri hari ni. Sekarang di tekanan di belakang. So reason dia kenapa kalau kata ada kudis tu lebih memudaratkan dia daripada tak ada. So kita nak cegah benda tu berlaku. So maknanya kata kalau pesakit, orang yang dah sakit, dia adalah lebih sukar untuk dipusingkan. Kalau kata nurse ni besar saya dulu 37 kilo je dulu, kecil je saya kan. Orang panggil saya sambil kecil tau kalau saya pegang. So imagine lah macam mana kalau saya seorang-seorang nak buat. Memang saya tu saya kata saya selalu ajak benda doktor pun sama-sama angkat patient kan. Family member of course lah kita. Kita benarkan dia menunggu, salah seorang menunggu kan. Supaya benda-benda macam tu lah yang totally full kena help to assist the patient dengan dia tu memang kena involve lah sebenarnya. Tapi kita sebagai nurse kadang kita tak explain sebenarnya, dia orang tak faham.
Betul.
Kita betul-betul explain bagi sampai dia orang faham. Kadang-kadang kita punya explanation tu tidak very clear. Sebab tu kadang-kadang kita tak dapat kerjasama dari pesakit ataupun daripada family member. Itu penting sebenarnya. Sebab tu saya kata sangat penting kita educate people juga sebenarnya. So kita nak tambah tu lah.
Dia part of it to add more, understand, sebelum kita start patient education ni kita kena establish a very good rapport dengan family members and a very good therapeutic relationship with our patient. Bila kita dah establish patient yang ada kecederaan spine, benda tu patient tu sendiri dah go through a very much of a psychological aspect punya ni lah kan, demotivation and everything. And then kita tak boleh meluahkan semua tu sekali pada pesakit tu. It will take one thing at a time. But kita kena clear that the intention of doing this, contohnya the intention of pusing 2 kali 2 jam sekali ni untuk apa? Nak elakkan kudis kat belakang, kita nak elak bagi bersih, akan tengok kita.
Ya betul.
Bila dia tengok kita, tolong pusing ni, kalau you tak pusingkan nanti kulit ni pecah, nanti doktor susah nak buat operation. Tolong saya ya, kita tolong sama-sama. Then memang if you buat macam tu, walaupun you ada banyak kerja lain, tapi if dia boleh nampak you sendiri daripada raut muka kan, that you very concerned, dia akan dengar. Baik waris pun selalu macam tu. Tapi saya yakin juga ada juga setengah waris lepas tangan. Ya. Tapi this is the challenge lah. Ini adalah challenge untuk kita dalam pekerjaan kita, because we are trying to do our best for our patients, and then and basically we are the spokesperson for our patient kan. Itu baguslah soalan tu Farini. Alhamdulillah. We have a very good session here. On behalf of Mona, we like to thank Dr. Norhaini and Dr. Haini.
Belum doktor.
Belum. Amin.
Amin.
For semua orang ya, Puan Norhaini dekat nak habis lagi dia punya PhD. So insyaAllah tak lama lagi kita panggil dia doktor lah.
InsyaAllah. Amin.
We wish her all the best, and we also hope that most of you join Mona so that we can have a lot of this kind of session. Lain kali kita akan ada juga untuk bincang santai apa ya ni hari tu ni. Buat bicara santai. So that we can also hear from all of you. You know, can help each other. We can have a session on that also. So with that, saya ucapkan terima kasih pada semua partisipan yang datang, and please fill in the kedatangan ni sebab your certificate will be ni.
Screenshot kan partisipan. Mana tengok partisipan?
Mana partisipan tunjuk muka lah.
Tunjuk muka lah. Nak kena ambil gambar kot. View.
Boleh cantik. Sam Yin Yong.
Okay, boleh on semua video.
Can everyone on your video so that we can take a picture together? Sam, now I can see you. iPhone 2 ni. Anis Sarina, can you on your video so that we can see and take pictures together? Everyone? Izzati ada. Liana, Syada, Sulo. Farihan, Siti Aja, Bibiana. Okay, Junaida. Nice meeting you guys. Seronok tengok macam ni. We can actually semua dengan nawaitu yang sama to gain to actually learn from each other.
Okay, kita ada 3 page ni. Stand by. 1, 2, 3, smile.